Good day to all the viewers of the show. I am Dr. Andy T. Panes, a pediatric infectious disease specialist. I, together with the members of the Philippine Pediatric Society, would like to thank Ms. Token Lizares and Ms. Lilani Salem Alba for inviting me to the show to talk shortly on dengue fever. Kay tungod, gasaka na naman ang kaso sang dengue diri sa Bacolod as well as sa Negros Occidental. Kay tungod, it's rainy season na. It has been recognized that the peak cases of dengue are seen between July to November. And dengue has been recognized to be a fast-growing vector-borne disease in tropical and subtropical region, especially the Philippines, with the age of predilection within 5 to 9 years old. Dengue fever is caused by dengue virus brought about by mosquito bites called Aedes aegypti, which are day-biting mosquito and thrive in stagnant fresh water. They usually bite between 2 hours after sunrise and 2 hours before sunset. Since gasaka na naman ang kaso sang dengue, we need to be informed on the basic facts in dengue such as ang signs and symptoms, treatment, home remedies, prevention, and recognition of symptoms for admission. So what are the signs and symptoms of dengue? It can be a myriad of symptoms and can be non-specific. But then, ang most common is fever, headache, retroorbital pain, bleeding, rashes, as well as nausea and vomiting, along with decreasing platelet and increasing hematocrit count. With increasing hematocrit count, galapot ang dugo sang bata. Once maglapot, dira gaset in ang ato na problema. Wala specific antiviral treatment for dengue, but with early recognition and early medical attention leads to good prognosis. What are the home remedies na pwede nato mahatag sa bata with suspected dengue fever? Because not all dengue fever are admissible. Only those with warning signs and severe symptoms are admissible. Those without warning signs, pwede lang matreat sa balay. So ano pwede mato maubra? Encourage oral fluid intake of orisol, pwede man fruit juices, and fluids with electrolytes. Give paracetamol every 4 to 6 hours per day. If with fever na 37.8 degrees Celsius and above, if hindi nga po makuha ang hilanat, pwede man ta ka tepid sponge bath. But then, if with clinical deterioration and no improvement, we have to seek medical attention. So what are the signs na kinahanglan nata mga ibulig or mapa-admit sa hospital? Number 1, the child appears lethargic, uncomfortable, and irritable, severe abdominal pain, persistent vomiting, bleeding, may it be na mamusun dugo, masuka dugo, maglam bleeding, or masunggo, cold and clammy extremities, wala ka panghi ang bata within 4 to 6 hours, which is a sign of dehydration. So kung makita nyo ina, so kanto naging kamo sa doktor nyo or diretso na kamo sa hospital. Prompt consultation to your doctor is very important to prevent complications of dengue. So what are the complications of dengue? Pwede mag-bleeding, pwede mag-hypotension. With prolonged hypotension, pwede mag-shutdown ang organ system, ma-shutdown ang brain, ang heart, ang lungs, ang gastrointestinal tract, as well as ang kidney, leading to death. So as the saying goes, an ounce of prevention is worth a pound of cure. This holds true man sa dengue prevention. And DOH has formulated a slogan para ma-remember natong tanan. Amo ni siya ang 4S. Ang first S is search and destroy mosquito breeding sites. So, kinahanglan gid ta maninlos adlaw-adlaw sa atong paningmalay. Ang mga guma na may mga tubig ipang ula gid na, ang mga garapon na may mga tubig ipang ula man. I-check yung man ang inyong mga tanom, kag especially mga bromeliads kay gas stay na manada ang water, iula nyo man. Next is secure self-protection by wearing long sleeves or long pants, and of course using insect repellents. Number 3 is seek early consultation. And number 4, support fogging and spraying. That's all. Thank you very much. I hope nakahatag man ko sa inyo enlightenment on dengue fever. Thank you again and be safe always.